You are listening to Radio Bilingüe on WBFO FM HD3 Buffalo, powered by Sin Fronteras Western New York and presented by Batavia Downs Gaming and Hotel. More information at bataviadownsgaming.com. Sin Fronteras Western New York, Buffalo's media platform for Western New York Hispanics,
producing bicultural content that informs, entertains, and inspires the forward thinking.
Sin Fronteras Western New York, delivering bilingual stories,
hot topic conversations,
and the voices from our Latino community.
Sin Fronteras Western New York,
la única producción contemporánea en español
y en inglés en la ciudad de Buffalo. Sin Fronteras Western New York,
your connection to cultural ties in Latin America
and hyperlocal news in the Western New York area.
Sin Fronteras Western New York es para ti.
Hello y bienvenidos. Welcome to Sin Fronteras Western New York. I'm Lorenzo Rodriguez, and I'm excited to have you here with us today on Radio Bilingüe 88.7 HD3. Now, if you've been listening to our program, you know that we focus on important issues that impact our Hispanic communities here in Western New York, and today's no exception. Today, our guests are two key leaders in community healthcare. We have Joanne Haefner, President and CEO of Neighborhood Health Center, and Dr. Chistopher Biondolillo, the organization's Senior Medical Director. Now, Neighborhood Health Center has been a vital resource for quality healthcare in our area. They offer comprehensive services, family medicine, pediatrics, behavioral health, dental care, and they do that all regardless of insurance status or the patient's ability to pay. Their mission is simple, yet one that's very powerful, which is to provide compassionate, equitable care that ensures that everyone, even those in underserved communities like ours, has access to healthcare that they need. So in today's conversation, we'll explore how they're making a difference in our area, expanding access to healthcare and offering services tailored to meet the needs of our community. We hope you enjoy. Vámonos. Today, I have the pleasure of being joined by the CEO, the President and CEO of Neighborhood Health Center, Ms. Joanne Haefner. Welcome, Joanne.
Thank you very much. Happy to be here.
And also their Senior Medical Director, Dr. Chris Biondolillo.
Pleasure to be here.
I hope I put the right emphasis on the right syllable there.
Nailed it.
Got it?
100%.
Okay. It is Italian, right?
Yes.
But we'll get to it in just a bit. You have some very close ties to the Hispanic community.
Oh, very close.
We'll get to it, Chris. But thank you both for joining us on Sin Fronteras.
Thanks for having us.
Excellent.
And as I mentioned, both Joanne and Chris are from Neighborhood Health Center, an organization here that's been in the community for quite some time, has 6 locations in the Western New York area in Bladesdale, Bridgeview, Matina, there's a Northwest location, a Riverway location, and down in the South Towns. And, need I forget, a mobile unit as well that comes to you where you need to. Neighborhood Health Centers, it's been around for how long? It's a medical group, but what is it? What do you specialize in? What's your history here in the Western New York, Buffalo area?
Yeah, Neighborhood Health Center is 37 years old. We started in the Black Rock Riverside area in one of the community centers that was a converted school when kiddos and their mamas couldn't get care. And some of the concerned citizens wrote to the federal government for some grant money called the Federally Qualified Health Center or Health Center movement, and were funded. So we were built out of that. We always have had a vision of caring for the west side of Buffalo and new Americans. Was our original charter. And so 37 years later, what that looks like has certainly changed. But our roots are in social justice. That's why the health center movement started in 1965. We're the oldest health center in all of Western New York doing this work.
Say that louder for the folks in the back.
Yeah, and this work is around social justice and health equity for us. And eliminating poverty. And we focus on folks who live in poverty, but everyone's welcome. And we also think a lot about health equity and solving for that with everything we do.
And as you said, right in the middle of Western Buffalo, the west side of Buffalo, Black Rock. That's very strong, predominant Hispanic population there.
Yep.
And one thing I noticed, and I applaud you for, is working with folks of all different, not only backgrounds but also socioeconomic backgrounds.
Absolutely.
And providing services despite perhaps sometimes not being able to afford some of the more higher priced services throughout the area. So I think that's something that needs to be really, really heralded and applauded. But besides, I guess, general medicine, what are some of the services that Neighborhood Health Center specializes in providing the community?
So I do want to say that we are a doctor's office, so internal medicine, so adults and kiddos, and taking care of almost 30,000 people and providing jobs for the people who come to work. And I'd love Dr. Biondolillo to talk a bit more about our services.
Of course. If you were to, for example, come into our office, see me as a primary care physician, that's for me, that's the heart and soul. But we all love every department equally.
You're a family medical doctor.
Family
right?
medicine, yep. And so what I would do is let you know that while you're here, you might want to take advantage of seeing our dentists or our podiatrists, or using our wellness team to learn about nutrition with a registered dietitian. If you have wives, women or children in the family, we have our pediatrics and our OBGYN departments, and recently optometry is a new specialty for us. We also have, on the other side, mental health, our behavioral health team that's made up of a series of counselors, and recently added a psychiatrist to the mix. So it's a pretty new program, but we're looking to develop it further. And our pharmacy. I always forget one, and it's always a different one, but several of our locations offer pharmacy, where you can have a consultation with a pharmacist. There's a clinical pharmacist assisting our medical team, and they provide delivery to the home free of charge. So there's a lot of things going on.
Sounds pretty comprehensive as far as what you might need. You got some of the larger pressing needs in health, and the fact that you're also providing mental health services. I think we're going to get touched upon that in just a bit, but I think that's fantastic. Also, big, strong emphasis in meeting Hispanic patients in the language that they're most comfortable in Spanish. Is it bilingual services? Is that something that's expected or provided?
Well, health centers are founded in the idea of creating health equity, and giving somebody their care in their language of choice is a right. And we should be making sure we're doing that for people. When I started at Neighborhood, we took care of people in 2 or 3 languages. One was Spanish. It's close to 60 now.
Wow.
The highest percentage of folks who want to visit in another language are those who would like it in Spanish. So we do that through our employees, including Dr. Biondolillo, who's a bilingual provider, and many of our support staff. But from time to time, nobody's going to know 60 languages. So we do use a lot of services, interpreter services, to make sure that people are treated justly and that we understand each other well.
And I guess dealing with the patients that you do, a good number from the Hispanic population. We are a Hispanic-minded show. What unique challenges are you seeing besides, I guess, language? What challenges are you seeing that Hispanic patients are facing as far as accessing healthcare, or just in general?
I think if you start with the language, you can just imagine where that touches everything else, between transportation, between understanding instructions from a provider if you don't have that language translation service. Street signs aren't written in Spanish for the most part, whereas other countries might have 2 or 3. This is a country that doesn't have an official language, but it's definitely not built around a Spanish language population. So it's hard to point out where being a Spanish monolinguist is really an advantage outside of Calle Ocho.
I think some of the things that happen to our patients that when we meet them, especially the Hispanic population we're serving, we see people who haven't felt like they could come for primary care, and so by the time we meet them, They have pretty extraordinary examples of chronic disease like diabetes and hypertension. So we hear every single week about a patient who was so surprised to get to have a visit with somebody who would speak their own language and hadn't been coming to the doctor, and their chronic diseases are worse. So, and we'd really like people to come sooner, and lives are complicated and for reasons like what Dr. Biondolillo said, transportation, housing, fear of stigma for going for mental health care. Those are higher in the Hispanic population that we serve. We do have services to help with transportation and food security and getting insurance if you're uninsured. That's one of the things that we want to make sure that we can help people get the insurance coverage. We have about 10 to 15% of the people walk in the door with no insurance and no idea how to get it, and we get most of them some kind of coverage, but we do have a really generous sliding fee because we want to make sure that's not a barrier. We print our medication bottles in the language of someone's choice, and all of our pharmacists use the language line to explain meds, and we give out all that supporting documentation with every med in the language of somebody's preference. So that really does kind of meet people where they're at.
That's pretty huge because I have parents of my own that are monolingual. My mom's English is all right. She can defend herself, but yeah, I often think about that and others in their age group and age range where the language barrier is a problem and computer literacy is something I think about, and that all kind of intertwines with one another. If you don't know the language, you don't know how to get on a computer, you don't know how to access your information. So, well, I applaud you for, once again, being able to meet your patients where they're at. And as far as when I think of marginalized communities, minorities, the Hispanic population, there's a sense of distrust at times, especially with other governmental entities and services, but with medicine and health, you have to trust those that you're seeking their help. There's a little bit of apprehension I feel sometimes there. How do you see that? Is that am I being unfounded here? Is it something outrageous, or is it something you do see? And if so, how are you helping to build that trust and rapport with Hispanic patients?
Oh, I think you're completely accurate. Coming to the doctor can be a pretty harrowing experience if you've never been there. Even if you've been there 10 times, seeing a different person when you come in might be a bit of a shock. So we train our team and we practice a technique called motivational interviewing as a foundation of a way to really interview a patient and understand where they're coming from and hear them out and understand what their health goals are. And let them set the parameters and ask what they're looking for. Ask how you can help. Not coming in as maybe the old school doctor in the white coat says, I know what you need and here it is, but
bye.
Let the patient, yeah, exactly. Let the patient tell you what they need, and we come and say, okay, here's how we get you there. I think that's huge as far as just the person to person, but behind that structurally, we take care to assure that our patients are what's called in a panel system, so that once they're established with a new provider, they are linked to that provider. So future appointments can be made and scheduled ahead of time so that they're seeing the same person when they come in. They're not retelling the story. They're not digging up trauma that they've already went through with someone, either whether it's their counselor or their primary care physician, so they can pick up where they left off and they know that you know them. They'll ask about your kids and you'll ask about how's grandma doing and build it from there. And I think that's huge. One of my favorite things to do with with a new patient who may be Spanish as a first language speaker is introduce myself as I would anybody else. Once they determine, like ask me, ¿habla español? And they say, sí, a veces.
Un poquito.
A veces. Y después de a veces, ya vamos. And then you can see it's a palpable weight is lifted from whoever it is, and it's a bit of a not a trick, but a technique I use to kind of break the ice. And I think that's one of the ways. And it's an advantage I can lean into, having learned Spanish along the way, not being a native speaker myself.
I wouldn't say a trick. Don't categorize it as such. You said it. It's an advantage. And any way that you can relate to an individual, especially given the subject matter that I'm sure you're dealing with, it's just another way to make the patient, a little bit more at ease. Because I've seen in other places in this country where the opposite rings true, where it's this huge sprawling medical group where you're handed off from one provider to another, and that rapport that you mentioned and that you try building, it's not there, and that happens to not only the Hispanics but to African Americans, to people of all different communities,
for sure.
And that's just a prevailing sentiment that you just hear about, and it's unfortunate, but I'm glad that neighborhood health is working towards kind of building that trust and breaking down those barriers that you might have going into the doctor's office, maybe for the first time here in the United States.
Healthcare owns, patients deserve to not trust us sometimes. And so really understanding what those drivers are and trying to remove those barriers for people is an important part of what we see that we need to do. So we have to own that. We have to own that we haven't met patients where they are, and that people's health outcomes were different because of that. And that's another one of the things that we do is we collect information about race, ethnicity, and preferred language and your income, so we can actually look at your health outcome to make sure that everyone is doing as well, regardless of what color your skin is, what your if you're Hispanic or non-Hispanic, or if English is your first language, or if you live in poverty. And so we know how well we do, and we know that the techniques we use based on people's background has to change. What food somebody's going to eat, what activities they're going to need, and so we have to shift the way that we care for people based on who they are. And so it's really a wonderful thing when patients share with us who they are, and coming back repeatedly really builds that. So hopefully we can chip away at the reputation healthcare has built itself.
And it's a great thing when your guests can also preemptively see the next question, which was going to be about the social determinants of health. It's a popular phrase now, and it's one that we keep bringing up, but you touched on it so eloquently, what you're doing to combat that. That's
Sure. I think we have been talking about how, the shift in language to kind of social need, and then, how social need gets in the way of somebody having the quality of life, because we want to help people have the best possible life and health outcome. So our supports we can provide to help navigate that is what's most important. And so I do think that evaluating that in a really rich way may make a visit take longer to ask somebody a lot of questions about their social situation and us document it. But it does let us, if you keep coming back, it lets us dig into those with you and help you to get those out of the way to some degree.
And given what you're seeing with that patient pool and that portion of society with us, with the Hispanics, what are you seeing as some of the more common health conditions afflicting the Hispanic population?
Diabetes and high blood pressure. They're very common, and they tend to run together quite often, and that they're metabolic issues, and they all stem from a range of causes, including genetics and nutrition and exercise and diet and access to good food. But those I see in primary care, that's a lot of what we see across populations, but definitely taking a close look at how that affects our Hispanic population, and we see it all the time.
And are there, I guess, specific preventative health services that neighborhood health center provides or emphasizes perhaps to Hispanic patients?
When we're dealing with those kind of chronic illnesses, it really helps for not just the primary care team to think they're going to handle this alone, but lean into our breadth of services. So it's not uncommon that I'm pulling in one of my colleagues who's a registered dietitian to come meet a patient that's not on their schedule, that they've never heard of before, and to say, hey, what we're dealing with here is something that we can do a lot of without just a prescription pad, and you're only going to be able to do so much with medicine. As my boss here told me one time, you can't outrun your fork. So
I think that's so many things stem from just having a good diet, and unfortunately, fortunately, however you want to look at it, we Hispanics like our seasoning, we like our salt, we like our
arroz
con frijoles, we like pastelitos or pasteles. We like what we like. You said I'm Cuban. I love my Cuban coffee, and what does that have? A whole load of sugar in there. So it's it's really good. It's great. It's jet fuel, but not great in large quantities.
That's why they serve it in such a tiny cup.
A little tiny thimble of a cup. But
so some other things that we also provide to patients is many people who are thinking about having a child don't think that, I could do some things to prepare. So we really have a conversation with people who, is there a potential of a child in your future? There's some things we can help you to do to be healthier for that. And we do take care of hundreds of pregnant people each year. And Hispanic Latino patients are a really important part of that. And talking about seeing the dentist and getting your care in the language of your choice and seeing our behavioral health counselor, those are all going to make that pregnancy go to term more likely, have a healthy baby, and have mama come in with that baby and be able to see the pediatrician at the very same place where that pregnant person got their care and bring their family there. And that's one of the joys of being a health center is we have generations of families that we've cared for and have kids who we've delivered, and now they're having their children and bringing them as patients.
In 37 years, you amassed quite a pool of hopefully returning patients, and you touched on women's health, and I wanted to bring up the Women's Health Center that you have in Hamburg. It's relatively new, correct?
We've had
years.
We've had it as part of our family organization for since 2000, before 2000, but we did move it and grow it.
There we go.
In 2018. Because a big part of our legacy has been that a lot of people could not get access to GYN care, so to prevent pregnancy or to get birth control, and once pregnant without insurance, all the way down to the state line is how we started. And now there are other places along the way to the Pennsylvania border, but that's how we ended up with that first office. Then we've grown it. And really we have a care team on the OBGYN side.
That's in Hamburg.
That's where that largest office is, but you can get OBGYN care at any of our offices. And I think we are close to we will deliver over 400 babies this year.
Wow.
Far over 400 babies, and we really...
No easy feat.
Yes.
Takes a village, as they say.
And many of those patients, they probably split up in all of the office pretty evenly where our patients go for that care.
Well, as far as you also have midwives on staff, correct? We
do. And that's another way to meet patients where they're at. A lot of patients are high risk because of social things, right? And so they need more time with the provider, and midwives are really trained to spend that extra time with the patient in education, in getting social resources, in laboring with the patient, staying in the hospital with the patient for the majority of the time they're in labor. So the physicians do that as well on our team, but this team really does make it so our patients can have the diversity of who they can see through their care. And then we have community health workers who also are kind of embedded in the OBGYN team. So they help with the social resources, then making sure ready for baby, and helping to make sure you come back in when the baby's born and have care.
And I guess do you see any, not aversion, but any reluctance to those services? I only say that because we can be a stubborn bunch, and sometimes the idea of bringing in folks into the delivery process or the childbearing process is not something that's common at times. What I'm trying to get at is I think could there be stigmas? Do you find some pushback?
I think that our Hispanic community has faced a lot of stigma and judgment about pregnancy and child rearing. And we know that every single person's making the best decision for what's right for them. And I believe that we make it a safe place for people to come and not feel judged. This community has a little bit of a reputation of judgment, right?
I only say it, too, because my wife and I, when we were expecting, she was adamant about a doula. Mm-hmm. And to me, there was this faraway notion when what I knew up until that point, a doula was this new age thought that I was not aware of, and how dare you think that we can't bring this child on our own. And I now am one of the biggest proponents of doulas and midwives because just the conversations that come about there, conversations that hopefully scenarios that you don't have to encounter once you're in the child delivery process or leading up to it. But I think when I don't want to just generalize here, but we sometimes struggle with opening up or really getting into the not so comfortable conversations.
Right.
And a lot of those scenarios tend to come up in the child in the pregnancy process. And to have those conversations alone, I think that's a huge step for anybody that's going through it.
Sure, and they're another support. We have a number of our patients use doulas through. There is a program in New York where you can use them no matter what your insurance is. So if you have a Medicaid patient who we tend to care for a significant percentage of, there's a program where you could have a doula that it's paid for by Medicaid. And so it's bringing that, because it has seemed like a bougie white people suburban thing to do, just to say it. And it is something that families who are reluctant, new to child rearing, want to hear other ideas about how to get through this and help in planning, are feeling very supported by. So it should be for every family who's thinking about it. And it might not be for everybody, but it should be available to anyone who wants it.
And another area of health that you all address, and another area that has its own stigmas within the Hispanic population, primarily us male Hispanics, mental health. And that's also something that I believe Neighborhood Health Center provides as well. There's a division within the organization for mental health and well-being, right?
Yeah, that is 100% accurate. Our behavioral health team, as we refer to it, it's been around since before I joined the organization. It's really an integrated part of our care model where all of our primary care services know it's there and try to make that available to our patients. One of the things we do with every year at an annual visit or whenever a new patient shows up is screen for mental health concerns, including depression, substance abuse, and alcohol abuse, and try to incorporate that as a standard operating procedure so that patients will kind of open up to a standardized test where they might be a little put off about coming forward. Yeah, that happens too. But that's how you get the toe in the water. It's part of it. And then if they ask why you're asking, that's a even better way to start that conversation, and understanding that, we understand your mental health drives your physical health. If you're not in a good headspace, you can't follow these instructions. You're not going to want to go pick up a medication from the pharmacy. You might not want to get off your couch, and understanding that connections between some mental health, stress, blood pressure, heart disease, inactivity, all sorts of things like that. Part of an extension of that we've gotten into since I started with the health center is expanding not just counseling services, but also medication-assisted therapy for opioid dependent services. So we have all of our incoming primary care docs and our OBGYN team ready to, and our providers, our nurse practitioners, our PAs, not to cut anybody out, ready and trained to begin prescribing Suboxone and medications in that family for our patients to embed that as primary care. So you can see our team to check your blood pressure, get your vaccines, make sure your colon screen's up to date. And the same visit, we're keeping up on your prescriptions to make sure that you had a rough go, you were in a recovery program, but now you're in the community, you're keeping your family going, you're keeping your job going, and it's just addiction medicine is primary care, and it's one of the things we've tried to expand throughout our organization and continue to build our partnerships with our local mental health teams, local hospitals and emergency rooms, and destigmatize that, and it's going pretty well.
It sounds like just almost a one-stop shop per se. Almost everything is provided by you all.
One more thing about the behavioral health department that's very cool. In the pediatric department, we do a program called Healthy Steps. So we have counselors that are called Healthy Steps specialists, and they work with the pediatric providers and to screen kiddos 0 to 3 and get early intervention started. So this is a prevention way. So we do a lot in the pediatric department to assure that kids are as healthy as possible. Getting a kiddo screened and getting any services they might need for behavioral or language or developmental delays earlier is so much more effective for a family than it is waiting until the child's school age and has a problem. So we're really proud of this part of our pediatric care, and it is true team-based care. And so
That's huge.
And we do a reach out and read program in pediatrics and ensure that kiddos get a culturally, competent book at each of their well visits to really reinforce reading and literacy as an avenue out of poverty, and the kids who get read to will have a higher likelihood of graduating from high school.
Again, I repraise on you because these are things I don't know if I don't want to. Once again, I know my people, and preventative healthcare is not always the mindset. It's always reactive. Tengo una tos. Oh, I gotta go see the doctor. Oh, my hip's acting up. I gotta go see the doctor. It's never, hey, what should I be doing now to prevent all those things later on? I know this because I have, once again, my whole family. I see it, and I gotta imagine it happens in a lot more places than just in my family. So the fact that those conversations are happening, the fact that it's almost a multi-pronged approach and bringing in other fields in to meet with those patients and address things preemptively. I think that's something that not always is also sometimes not even known.
Right.
If you come from another country, some of these procedures, these areas of medicine are not commonplace as here, and if you don't know, you don't know. So
for sure, that's a nice thing about peds is pediatric care. There's a universal truth that parents will do for their kiddos, and so we're teaching. A pregnant person will have their baby, and they'll forget to come for their follow-up, but they will bring the baby in. And so while they're there for that, we actually ask that parent who's there, did you get your follow-up? And a bunch of different questions on, are you taking your prenatal vitamins still? Are you smoking? Do you have depression? And is there anything else we can help you with? Because we know that parents will take care of their kids. And for some families, this is the first they've ever seen of prevention and they're like, wow, I could do that. Mm-hmm. And my kid could have that, a better life and not have diabetes, or a better life and have all their teeth. And sometimes it turns the light on the parent to say, I am a role model for them, so I'm going to do a little of it myself.
I want to pick up what you started talking about with population or certain people being stubborn about healthcare. I think my wife's also Cuban, but from the island, and growing up in a different system. And it really makes me start thinking about the system of healthcare and that access and reluctance. I was talking to her about growing up. You're always going down to the policlinico. If something's happening, you're getting your shots for school no matter what. The doctor's not that far away, and you might interact with them differently or trade them some pastelitos for service, or just dress up a little fancier to go see them. But our system here in the United States, there's way more barriers to just getting in for what we should be looking at as a right more than a privilege. So yeah, there's definitely things to share back and forth.
It's a different world out there outside of here, and I'm glad you brought that up, because we're not the way we are because of wanting to be. It's just that's part of the upbringing, part of our environment, part of our history. So that's a great point. El policlínico. That's definitely a thing. Great medicine in Cuba. I've been told from my parents and from what I've read, it's one of the benchmarks of Cuban education and professionalism is their medical field. It's one of the larger ones, but yeah, it's kind of like an expectation. It's kind of there's a whole different relationship with medicine in the Caribbean and elsewhere. So,
well, even right across the river here in Canada, they got a different system, but you hear good and you hear bad, and no one really knows unless you've lived through it. So,
and I'm speaking for those that are joining us now, I'm speaking with Joanne Haefner and Dr. Chris Biondolillo. They are both from Neighborhood Health Center. Joanne is the president and CEO, and Chris, you're the senior medical director of the center. And we've been talking about just health inequities, disparities, knowledge within the Hispanic population, and what Neighborhood Health Center provides to them and anybody in our Western New York backyard. But as far as let's go bigger picture here. 4 years ago, I hate to bring up that dreaded year, but 2020. And one thing that's always in my mind as we somehow societally turn the page on that era, it's still there. It's still prevalent, and some of the ramifications of that period of time are still here. As it pertains to the medical field, I have to imagine, and it's something I always thought for first line responders, for anybody in police, fire, medicine, the amount of stress that was experienced at that point in time, and the upheaval and everything after that. Medicine, from first-hand experience with acquaintances and friends that are in the field, I know and I hear it. But now, a few years removed from that, how has Neighborhood Health, and how have you seen those stressors? Are they still around? Have they lessened? How have they been alleviated? I know that's a big question. I asked a lot there.
Well, I'll go back to the beginning of the pandemic, and I think something that we might try to forget is that everyone was scared and everyone didn't know what to do, and that includes our clinical team. We had never seen something like that before, and so we had a lot of changes to make, and not a lot of time to do it, and a lot of decisions. But we were able to rally, and our leadership team got together every morning for weeks, months at a time to figure out what's the news, what's the updates, how are we going to pivot, how are we going to get the services to our patients out there. And we were able to rally and never really close our doors. Some of our staff adjusted their schedules, but never once did we not see patients at the health center. So there is some silver lining to what happened. It helped us develop telehealth medicine visits, so we could remotely contact our patients using a smartphone or a laptop. It helped expand our remote screening services that are available. So people weren't getting in for colonoscopy screenings, but we can send a kit to your house that'll get ahead of any problems that might come up. So a lot of innovation, and now I do think that it has mitigated significantly the development of the vaccines and the distribution, the fact that I'd say 99% of our staff has already been through COVID in their household and made it through, and then it gets easier every time. Having more information and more remedies. Like started, it was don't touch me, stay away. Then that transition, we have medicine for this now. We have experience. We have had it ourselves, so I can teach you how to manage it better through while you're at home, and then we can deliver that medicine from our pharmacy to your door with no extra cost. So nowadays, we still see active cases. We still treat. We still we partnered with the government to get on-site rapid testing that is state-of-the-art, so that we can make that diagnosis and distribute the medicine in the same visit. We have the protocol so that even if you're actively ill, we can take care of you in person. It's not just okay, we'll call you about this. And then now what we're looking at is really the aftershock and really seeing where the dust is settling. And that we keep kicking the can because there's a new vaccine, and that's an opportunity to engage the patients. But you definitely see people in a splitting. I've had so many vaccines, I think I'm good, and others who, I'll keep getting it. I want the most up-to-date, cutting-edge medicine. So yeah, it's going to be with us for a while.
Yes, we roll through and look back. Two things that stand out to me. One is prevention did stop for a lot of patients because survival became number one. So we're still catching up on prevention, and I think we've really seen the light in getting prevention back where it was prior to the public health emergency. The other is the workforce, for sure, and we have definitely seen a percentage of people. We didn't, no one left during the pandemic. Really, people stayed there to care for patients. As we came out of the public health emergency, definitely it was hard for some people to continue to stay in healthcare. And the ripple continues. New York State is severely underserved with physicians, with nurse practitioners and PAs who want to do primary care, and that includes adult, pediatric, and OBGYN. It's severely underserved for the number of providers we need. We also are understaffed as a state and a region for RNs and LPNs and dentists. So those are the ripples of people just not being able to do this work anymore. And it's one of the things we've had to do is say, but people still need us. So how do we get the care out to people, knowing that there is a shortage of some of these positions? So that's how we've really evolved that care team, hiring from the neighborhoods where we have offices, doing job training, creating community health worker and care coordinator positions to really support the care team for the things that need to be done for a patient who has a lot of social needs, and freeing up the in-exam room provider, doc or NP or PA or midwife, to focus on that patient and take some of the other burden off, knowing that it's so hard for us to staff.
I'm glad you went down that route, Joanne, because that's that B word, burnout. I think everyone has experienced that one way or another, but in the medical profession, it's got to be one of the factors there. I know we spoke prior to the interview, and something that I've seen here in my short time here in Buffalo, the idea of folks departing to other places. They study here. Chris, you're a UB grad. You go Bulls.
Go Bulls.
And you gotta keep those bright minds here in Western New York. I know that you mentioned a big factor that you're one thing you're stressing is recruitment, not only just in general, but especially for those populations that you serve.
Absolutely.
Why that's so important, as we mentioned prior, it's seeing somebody that's like you, speaks your language, and you can trust. What is Neighborhood Health Center doing to hopefully keep that talent in-house, keep it here, keep it in Western New York?
Over the past 7, 8, 9 years, we've really evolved the way we train people. Think about resilience as the counterpart to burnout, and what things can we bring to help the work we do, which is very trauma-based. To hear about the lives and the hardships of the people we take care of is probably the leading, driver of burnout, is feeling kind of some compassion fatigue for how hard the lives of the people we take care of are. So how do we create an environment where people really feel lifted up by the work? Has been our mission for close to a decade. And so that's a lot of around trauma-informed, resilient-oriented, and equity-focused care. And those are the things that we bring in and train brand new employees about. We know that if we hire a workforce that looks like the patients we serve, that the patients and the employees feel great about what's happening, and that keeps people here. And then we teach people skills that maybe they didn't have about self-care. We do a lot of wellness initiatives with employees to say, maybe take some of this PTO and go take care of you and
you don't
come
use
back.
You can't roll it up.
Right.
You can't take that with you to the grave. You got to use your PTO.
Right. And really give people an opportunity to learn about what is bias and what is racism and how that impacts how we feel every day, and how interacting with others feels harder sometimes because of the pressure I feel because of those things that have happened to me, and how do we help people to get through that. So we work on that with our workforce because we want people to stay healthy and keep doing this.
And we want people to stay here in Buffalo.
And we really want people to stay here in Buffalo. Absolutely. When we are able to recruit for a position and it's somebody who's either coming back to Buffalo or they are moving to Buffalo for us, we feel really excited by that.
And I only bring this up because it's something I've seen also with traveling nurses and traveling medical professionals. It's on the rise. I see people leave for months upon end to go to Washington State or wherever, where have you. I guess the next question there is, what is your approach to recruiting and retaining those healthcare professionals in a competitive market?
Sure. That's a wonderful question. Thank you. We have been working on evaluating what is living wage in Western New York and ensuring that our entry-level staff have job opportunities that are career pathways to learn more with us so you can stay. And for people who are already trained professionals, or then really making sure our salaries are competitive with every other place they could work, because sometimes people think if they work in a mission-based organization caring for our community and the people who deserve care, that you might have to give something up. And it's the legacy of a lot of health, primary care providers like us. So we really want to continue to grow as an employer of choice. And that includes that information I said to you a little earlier. We collect race, ethnicity, language of preference, poverty level from our patients so we know their health outcomes are better. But we also collect it so we know that our employees reflect the community we serve. We have a volunteer board of directors, and 51% or more of that board has to be patients of services of the health center. So we're very proud that ours is 88% patients right now. So
that's
those
great. The people that are actually getting service are the ones.
Are our volunteer board of directors.
Who knows the insides of neighborhood health better than their own patients.
And those volunteers also reflect the composition of the patients we serve. So it's a very cool model, and it's really about loving our neighborhood and wanting to see it do better because we are there.
And Chris, I go back to you because you mentioned that C word, Cubanos. You mentioned Cubanos, and you yourself are not Cuban, but your partner, your wife is Cuban, correct?
That is correct. My lovely spouse of over 10 years, Marieta.
You can't get more Cubana than Marieta. I know Marieta actually, probably related. Who knows? But how is it being in a multicultural household? What's your background, your nationality, your ethnicity?
I'm a Caucasian, sir. My father's side of the family's Sicilian, and my mother's German, etc., European, whatever. And we grew up in the South Towns, and growing up, the closest we got to probably multi-ethnicity was the Olive Garden. So I was fortunate.
Hey, your family there.
That's right. It felt good. So I was fortunate enough to pick up Spanish and want to learn it at the University of Buffalo, which had a program to Cuba. And so that's how we met, studying abroad.
And she's from the island.
Yes.
Native Cuban.
That's right.
And so you met Marieta in Cuba.
We were classmates in cinema history and
cinema history.
History of Cuba Part 1. So up until the what we call the Spanish-American War. But
so how would you describe that dichotomy of because I ask because I'm living it too. I'm the Ricky Ricardo, and I married a Lucio Ball. So how does that do you have kids of your own?
we got twin daughters. Yeah.
Oh, I'm almost seeing a reflection of me, a mirror image. So how is that? How is it mixing both backgrounds? And you mentioned also an Italian heritage and German heritage. Those are also two strong identities, cultural identities, and then Cuban. How do you intertwine all those, and how do you keep those different cultural identities alive in your children?
Oh, that's a great question. I think it all starts with, me and my spouse and being able to meet kind of in a vacuum. Studying abroad in Cuba was not, you didn't have a lot of options of where to go. You weren't very mobile. We were on foot a lot of the time and not a lot of distractions. So it really allowed us to get to meet, as students and then let that develop. It took us about 8, 9, 10 years from that meeting before we were able to get serious enough to become engaged and then
play the long game.
The long game, that's right. And a couple trips back and forth, long distance communication, but the fiance visa process. So a 90-day fiance is not as glamorous as television might play it out. But it really let us kind of develop as individuals and then develop as a couple. And then when we got married, we were actually living in Louisiana. She flew over. I was doing a residency in New Orleans, and that allowed us to grow. And we picked New Orleans instead of staying local, one, not to shovel snow for 3 years, and two, because knowing that the Latino Caribbean community was really in the DNA of New Orleans. And so that allowed us to form our own little community. Met a lot of good Cubans down there, some great musicians, some filmmakers, and still keep in touch. Now, being in Buffalo, it's kind of a different situation. My kids are Buffalo is definitely winning the culture war. The rest of our family on my wife's side is still either on the island or in Spain, Florida, but my family still has deep roots here, and so the Bills fandom, the chicken wings, the
beef on weck,
the beef on weck, and the local school system. They're in the same district I grew up in. They're in the same hometown I grew up in. Having two of it at the same time really put our roots down close to mom and dad. But we still, they were raised on Spanish language. I used to joke when they were two, speaking of their mix of Spanglish and baby language, it sounded like two little soprano Jabba the Hutts. Every third word was something you understood. But yeah, and we try to keep that part of their culture strong. We are on WhatsApp with Grandma in Havana. We're in. We have local. We built a local friend group that has some strong Colombian presence and some Mexican presence and other bilingual families, so that the kids don't feel so isolated in the Hamburg School District. And they've found. They're doing really well. They're thriving.
And Mari's professional background really lends to you are not getting away from it. Chris is a wonderful physician and been a great addition to our team, and he married up.
That's right.
She's
I'll get
amazing.
my coverage on that one.
Well, that's what we all say. I'm going to say the same thing too. I won the lottery with mine, but I asked only because, like I said, I love the fact that it's just so many different point of origins meeting all at once, and now you have two wonderful daughters that are the combination of all that. And how do you make sure that each part of you, both of you, lives on through them? I think that's my battle, is always trying to get my two to speak Spanish, and with few people, Spanish speakers in our neighborhood, it's sometimes a challenge, but not impossible.
Well, the kids might have my last name, but they're definitely bringing Cuba home when we're yelling for Lucia and they, which is great because, I got my own little Lucy at home to yell at when she's acting up.
You got some explaining to do.
He did it. He did the thing.
I could do it because he's my guy. No, he's my account. No. Well, thank you for that, Chris.
His wife's local. She's from Jamestown.
She is. I went there not too long ago and saw Scary Lucy. If for those listening, if you haven't gone to Jamestown, a mecca of comedy, one would say.
That is accurate.
But we were talking about comedy for a brief moment. We were talking about health and health equity. and the great work that Neighborhood Health Center is doing here in Western New York. I got Dr. Chris Biondolillo. Wow. Let's try that one more time.
Trabalengua de verdad.
Seriously. I'm here with Dr. Chris Biondolillo and Joanne Haefner, both from Neighborhood Health Center. And before I let you all go, how can folks get in contact with Neighborhood Health Center? What services would you like to promote or mention that might not be front and center in everyone's mind? How can they learn more about the fine work that you're providing?
Our website's a great place to look us up. Our telephone number's on there. That's a wonderful way to see all the services. You can get a peek at the providers. We have pictures of all of our providers, which does make it easier for you to decide who you might connect with. You can start with primary care services, or if something else is urgently going on, we're happy to meet you.
And what is the webpage, Joanne?
It is nhcwny.org.
And the mobile unit. How does that work? How does someone find the mobile unit?
Oh, thank you for asking about that. We right now the biggest portion of the time the mobile unit is on the road doing services is with our partnership with the Buffalo Public Schools. So this is part of our initiative for kids to be high school graduates. So that is our one place where you're sure to find us is out in front of a number of the Buffalo Public Schools. But we also use that to go to community events, and our mobile unit marched in the Hispanic Heritage Festival.
There, yep.
And so we bring her to festivals so she can tell people who we are and where we are. But we do use the unit for a lot of outreach. So you can look on our website. It always says where it's going to be, and we're always looking for good community partner organizations there that want to give access to healthcare to the people that they're taking care of as well.
I'd also say we're in the neighborhood. We're old school, so if it's Monday through Friday and it's bank hours, we're going to be open. You come on in and say hi, and our front end staff will say hi, and they'll take your information and try to get you connected with whatever you need. Don't be shy. Those doors aren't locked.
Walk-ins are welcome.
Walk-ins welcome.
To register and
schedule an appointment depending on availability and access. The end.
We would love to meet people and have them see the beautiful health centers that we hope help neighborhoods to feel more welcoming and make people proud of where they live. That's really what our goal is. So,
and I'm fortunate and glad to have met you both, and for you both to share the fine work that you're doing. Thank you so much. Thank you for the time and the knowledge you imparted on our audience today on Sin Fronteras, Western New York. Thank you so much.
El placer fue completamente mía.
And thank you so much for having us.